So I am a practice management coach. I hate the word consultant. I get that all the time, but in healthcare, primarily with dentists, because that's where I was trained as well too. And I have done everything I can, not just like elevating specifically women in dentistry and that like self leadership and confidence. And then that's really moved over also into the insurance aspect of how we go ahead and process insurance and fighting for our patients' care as well too. So otherwise, on the free time, I have a bunch of kids. They they keep me busy no matter what. So there's that part of it. But yeah. So from 30, I've had early screenings. My mother had breast cancer before the age of 40. Other family members as well too. Very high risk, and we're Ashkenazi Jewish, so it just like keeps jumping up the scale for high risk. And it's always baffled me that every year I have to pay the difference to have the 3D mammogram, but with super dense breasts, I have to do it, right? And so in 2021, they found a mass on my right side that was suspicious and did a biopsy. Thankfully, at that time, it was benign, but it had precancer indicators. So they were really concerned and they just wanted to watch it, like put this metal clip in and watch it. And I'm like, no. Why are we not doing prophylactic breast removal? And it was denied. And even then, like, I really like my doctor, but I felt as though I was being exaggerative of why I wanted that. And it really wasn't a great feeling. But nonetheless, I was able to fight and get every 4 months a rotation of MRIs and mammograms in it. And 18 months later, they found 2 different tumors on the other side. And it was so far in my axillary tissue that the oncologist had said it would have been there for a couple of years had I not caught it. I had no bumps. I had nothing. It was all in MRI, which mammograms are such dated technology. It really is. And so to know that, and I could have avoided cancer. There's 2 different types of cancer at that too. It really fueled my fire to understand the insurance aspect of it and help others navigate through it, because it's a system that's not meant for doctors to have their autonomy of care, or patients, that collaborative effort. Like, stop gaslighting us. Like, at the very least, like, let's start exploring something else. But that's doesn't happen often. And so going through that process, I avoided having any radiation, any chemotherapy or anything as well too. So having my bilateral mastectomy done, and the healing from that was great, but it never stopped, even with any health concerns that anybody has. I mean, just recently with having an iron infusion, the insurance company went ahead and like spun it and put a different type of iron in there that they would approve for. And it's like high reaction where people can die from anaphylactic shock. And sure enough, they said, if anything changes, you feel different, you do anything, let us know. And I did. Sure enough, I was like, I have itching in my ears. I don't know if that's it. And so it's like, it's just this process of between the gaslighting at the doctor side of things, and then a third party that's also dictating this care, that women are specifically are really shortchanged on this, because we're not listened to. There's education going back 50 years ago that they're still being taught today, right? And so to me, it's baffling that it just continually happens over and over and over again. And women finding their voice, because I too, even though I know my voice is strong and I can push back, there's things that go on that I still to this day feel like I can't talk to a doctor about, right? Like, I don't want to be judged because I feel like I'm 40 and falling apart now, but I'm like, it does. And it's really hard for me, which means I know it's so much harder for everyone else. They just accept it for what it is. It's not accepting no for an answer. I mean, That's really what it comes down to. And fighting up against putting complaints in and letting the insurance company know that you're putting these complaints in, asking for a peer-to-peer conversation for the doctors as well on this. I just don't take no for an answer. It's not an option when I know me. Why are we going to wait for something to be cancer? But nobody really knows how to go or where to go, right? So there's appeal processes that unfortunately, doctors don't have a whole lot of time on their hands, nor do they know too much about how to appeal things. So I'll give them a little bit of that. But we have the opportunity. Every time we receive an EOB back, like there are numbers that are on there. And for everybody, there's your state Department of Insurance and Financial Services in placing all those complaints and making sure that we not just place the complaints, but put a copy of your complaint into something and send it back to the insurance company, letting them know on this date, this is what I did. They don't want those complaints to come in, right? They don't want to have to deal with a peer-to-peer review because most of the time it's this auto adjudicated process that's denying our care. It just really is. And, a claim that gets sent out that shows my birth date, my age, any other health things I've got going on, whatever it might be, and just it's deny or approve. And that's terrible that a machine does that. And then even then, the process to get through to human, and it's again, try one way, try another, call somebody else. If they tell you no when you're on the phone, you got to call back. And it's really the only fight that we have. And even with health professionals, right? Again, not trying to say it's easy at all to tell your doctor, I want a second opinion. It's not. This is somebody that they see you annually. You don't want them to feel as though you don't trust their care or anything of sort like that. There's kind of like this level of guilt when we go to a doctor's office that we can't push back and say, no, I want something better. And I would, even though you don't believe this is necessary, I either would like to process with you and move forward with this and explore it, or I'll find somewhere else that I can explore it. Yeah, I would reach back out as soon as you get that denial to the doctor's office first, right? Talking to them and seeing if they have a process. There's certain procedures that they're probably used to being denied very quickly. And again, too, it's an administrative burden. So reaching out to them and seeing what it is that they can do. Ask them if they have a phone number as well, too. So they generally have, the provider phone number or at least the accurate one. Because sometimes our insurance cards even, they will have multiple phone numbers on it and we don't know what the heck to do with it all, right? So stopping there and getting that information, asking them, what is it that I have to do to appeal this, right? They're more than happy to hear that a patient wants to appeal it. I kid you not. They're like, heck yeah, I don't have to do this stuff. Let's go for it. So when you're getting any of that information, go also to the plan booklet, whether you're on Medicare or Medicaid or any commercial insurance, you get this big booklet and you might have to print it off, but it's nonetheless, there are opportunities that we can find in there. And some of the tips and tricks that I've been able to find contact wise is even through having that booklet in a PDF. You can search the words appeal. You can search the words deny and start kind of building everything together. So one other amazing tip is ChatGPT. It really is. There's different GPTs that others have made that we can go over, but if we go ahead and we set in the timeline, our circumstance, anything that you're willing to share, right? I mean, it's going to go to the insurance company and that's it. But put all that together and say, what do I have to do? Right? And keep asking questions to ChatGPT. That has been my best friend when it has come to anything, is letting them know, you have to tell them, I need this type of tone. I need you to make sure that I have this, process. Please give me the steps that I need to do to take this. I live in the state of Maryland. This is my insurance company. Here are the codes. So as much as you can feed into the system on there, along with denial codes, it's amazing what it will get back. I'm terrible with spelling and grammar. Oh my gosh. I might be smart in a lot of other things, but asking that too. There's some levels of ChatGPT you can actually even put in your plan booklet as well too and say, hey, will this help? And so it'll review these different processes and letting you know. Certainly, as I said, that first contact with the insurance company, if you do get a no, or if you do get pushback, you have to keep calling. Don't accept it on that first answer. Don't you? They should be happy that you want to fight for it, but don't accept no. And they will continue to get the denials, and that's really what it comes down to, is tenacity. So after reaching out and putting all your case together, everything that you have, now moving that over to your state financial department. Don't wait for another denial. Put it in, place it, and repeatedly over and over again. Sometimes the insurance companies, they will have places where we can go ahead and send the complaints in as well too. Send it everywhere you can. Look for the emails on file where you can send these things to. Demand a response. Demand to have a phone call with somebody as well too. We have to fight for our own care in that regard, and just accepting the auto adjudicated process for what it is. 98% of Americans do it, right? It's only when you get to this point of absolute desperation and or fear, but even then, there's the fear of having this massive medical debt, and so we've got this crazy balance of, I want to be healthy, I want the access to care, I want this treatment that my doctor feels might be beneficial, or maybe they're completely on board with it. Either way, we want to make sure that it's just, not stopping with no. There are these processes in place, and don't give up, period. Nobody wants that medical debt. Do not give up on it. One woman in your family with whether it be uterine or cervical is very, very close tied to breast cancer or breast cancer. That's it, is all it takes for it to increase your risk. And so you might have some doctors that may say, like, I think you're okay. Don't stop there either and just say, I don't feel okay. Your sense of security is worth everything, right? Like, we think about it, and as we're doing even our self checks, I was part of this, right? I'm like, I don't know what I'm feeling for, really. Right? It is. They'll say, oh, you'll find it. But, our breasts are not exactly like the softest tissues to begin with. And so you can feel anything, and it sets you on this high alert. And so again, one family member that you are in a high risk zone, and we accept this answer and denial even from our doctors. We're like, you're going to be okay. And again, there's things that I would lose sleep over because of this. It's like, no, I know something else is wrong. And it's amazing to me that if we just talk to our doctor and just say, I understand you feel as though I'm not at a high risk, but I do want to have this in my rotation. It just matter of whether the doctors feel like it's a high enough risk that you need to have any of these imaging or anything of the sort, right? But it doesn't matter what they say. And I'll tell you, most plans do pay for mammograms before the age of 40. It is a systematic problem that it's not found in the doctor's office to go ahead and approve these things as well. So we are seeing some level of progress with accepting of that and rolling back the years for it as well. Yeah. So I just have to go every other year. I get images taken care of. So that complete bilateral mastectomy, and they do tests as well too. And they send your tumor out to identify what is your reoccurrence rate. And mine's very, very low. So for me, it was done. I could choose every year if I wanted to push for it, but I do feel comfortable being at the every other year at this point, and how low my reoccurrent risk was. So it is. It is. And you hear of women that are not that fortunate, right? That they're pushed into, I was told I was a great candidate for radiation. And I still was like, I don't care. We have another side that we're watching, And so it's absolutely crazy to me. So yeah, lean in when we're going ahead and reaching out to the insurance companies. Lean in on not just endometriosis, which can be perceived as just like, well, you're bleeding more, right? Like, that's not it. Grabbing all of the different health concerns and the long-term health concerns and adding this stuff into your communication is profound. is to say, here are the statistics. Sorry, I can't speak. In this area, here is where it's affecting some other things. Here's the long-term effect for how much additional healthcare needs I may have. So when you're pulling in everything as opposed to just the one diagnosis, right? Putting in historical information as much as you can, as when we're dealing with anything that is female related, go all the way back to your first menstrual period, right? What are different things you've had? I've been on birth control. Birth control states that I have a high risk for XYZ, right? So it's just like all of these different things that we can really tie and connect back together with our overall health. So don't focus on just the spot. Focus on everything when you're fighting for yourself.